Now let's see the umbilical artery Doppler velocimetry. So, as its name implies, we are going to measure the velocity of the blood flow in the umbilical artery, and this is being measured with a Doppler ultrasound. So here we are going to measure the velocity of the flow in the umbilical artery, both specifically during systole and during diastole. And so what we want is the ratio of systole and diastole. This is also called the ratio, the A-B ratio. A is systole and B is diastole. So systole is depending of cardiac output, and diastole is depending on resistance, peripheral resistance. Remember that during pregnancy we have a decrease in peripheral resistance, so the systolic diastole ratio decreases during pregnancy. This is a numerical value. Remember, we have a decrease in resistance. This is going to estimate, or this is going to use an estimate of the fetal well-being only if the fetus has intrauterine growth restriction. This is one of the most important things. The umbilical artery Doppler velocimetry only predicts of fetus with intrauterine growth restriction. This is not done for normal weight fetuses or fetuses which are large for gestational age. This is only done to evaluate intrauterine growth restriction well-being fetuses. So we measure the velocity of systole and the velocity of diastole, blood flow during systole and during diastole. We will get a numerical value. We can have that the SD ratio be a very low numerical value. If this is a very low numerical value, this is abnormal. I mean, this should be a low number because we are having decreased resistance anyway. So normal, this is a low value. But if this is very low, this is an abnormal value. Or we can have no diastolic flow, or we can have a reversed of the diastolic blood flow. So let me draw some examples. Here we have the baseline. So this is zero velocity. So during systole we will have something like this velocity of blood flow, and then a decrease in velocity, then again high velocity, decrease velocity, high velocity, decrease velocity. So this, the peak systolic velocity, this is the highest velocity we are having of the blood flow during systole. We are going to take this number and divide it by the end diastolic pressure, end diastolic velocity. So here at the end of the diastole, which is here, this is systole, this is diastole. At the end of diastole, which is here, we're going to have the slowest blood flow. So then we take this number and we will get a ratio. If this is a very, very low ratio, then this is abnormal. So, or if we have no diastolic flow, so for example, here we can say systole, diastole, systole, diastole, systole, diastole, systole, diastole. So here we see like these spaces. These spaces correspond to the lowest velocity during diastole, because here is the lowest point during diastole, but here this is diastole, but here, which is the lowest point, we have 0 velocity. So this is just a line. But when we are seeing this in the Doppler, we just see how this is shaded. So we just see this, and these spaces. This corresponds to no diastolic blood flow, no end diastolic blood flow. And this one, which is the reverse diastolic blood flow, we will have like systole and diastole and systole, diastole, systole, diastole. So this is the highest velocity during systole of the blood flow, and here we can see how we have the velocity during diastole is in the negative value. So this is 0, this is 0. Going down, this is a negative value. Here we are below this 0 baseline. So this means we are having a reverse of the flow during diastole. This should prompt delivery, or at least we need to further evaluate these babies. Again, this is only to evaluate for babies with intrauterine growth restriction. We can also evaluate or use this to evaluate when the patient has anemia because of aluminization of the mother. And if we have a baby which has amniotic fluid index less than 5 centimeters, then this needs further evaluation. So umbilical artery Doppler velocimetry, this is the ratio between the velocity of blood flow during systole and diastole, or AB ratio of the umbilical artery, if this is a very low value, or if we have no diastolic flow, this is abnormal, or if we have even reverse diastolic blood flow, this is very bad.